in today with our HealthLink Idaho. You know, growing up means more school days and more play dates as well, but that also means more opportunities to spread germs and get sick, which is one of the reasons why immunization is so important, protecting our whole family from illness. So we have Dr. Christine Hahn to tell us about National Immunization Awareness Month and how we can all be proactive. It's so good to see you, Dr. Hahn.
Thank you.
All right, so fill us in, give us some details about National Immunization Awareness Month.
Yeah, well, this is the time of year we're all starting to wrap up our summers,
Yes.
go on those last little vacations, and start to think about getting back to school. So it's a perfect month to just talk about immunizations in general. Of course, a lot of kids get up to date on their shots this time of year, make sure that they're ready. Also, we're starting to look forward to the fall when there's flu and hopefully not a severe RSV or COVID season, but those respiratory viruses are going to start popping up. So it's a good time to think about immunizations.
Yeah, absolutely. And I mean, a lot of kids, like you've mentioned, they go and they get their immunizations so they can go to school. Why is it important that we immunize our kids as they head back into the classroom?
Yeah, we really recommend the immunization because it protects not only your kids from infectious diseases, but it also can protect the kid sitting next to them or the kid in the lunchroom who some of them can't get certain shots because of maybe their immune system can't handle some of the shots that are live, for example. So we do recommend it for safety for the kids and for the teachers and other staff at the school. Keep everybody healthy. If you miss school, we all know that. You have a kid miss a day of school and it's hard to get caught back up.
Yes, well, and as a parent too, I mean, when your child gets sick, then all of a sudden you sit and go, okay, it's just a matter of time until I get it, you know, and then
Right.
and then the next kid in your house gets it. And so
Yeah.
however best we can avoid that type of situation, I think is just, you know, it's a better position for everyone on board. And I'm glad you pointed out too that it's also about protecting the child in the classroom or those around us, elders as well, who may not be able to become vaccinated for certain illnesses that can lead to some serious health complications. And so it's more about protecting the herd as well, right? It's not just about you, but it's also about your community.
Yeah, your family and your community.
Yeah.
And one thing too, you kind of alluded to that, it's us too. If my kid is sick, I may end up missing work also. So even if I don't get sick from
It's a domino effect.
It's a domino effect in the household for sure.
The joy of having kids, right?
That's
like
right.
It just comes with the package. I think that though some parents, we look at this and we question some vaccines for different reasons. And I think that there's this belief that some illnesses just don't exist anymore in our country. Can you speak to that?
Yeah, you know, I think we all, you know, the world as a whole celebrated when we eliminated smallpox, and the feeling was that's gone, that's done, we don't need to vaccinate against it anymore, and we don't. But the other diseases have been harder to get rid of. Polio is probably the next great example of something that most of us have never seen a case of polio. We don't have anybody in our immediate family that had it. And we forget about it and we think it's not a risk. But as most of us know now, there was a case in New York in 2022. So it can pop back up. We need to stay vigilant.
Yeah, and measles, wasn't that one that was over the past, like before the pandemic, but that did come up that I think a lot of people were like, oh, that's not for me to worry about, but then all of a sudden it resurfaced again.
Exactly, and measles is one of the most contagious diseases that we know of. It can be, you know, it literally can float through the air, and people are very easy to catch that again, especially if you travel or if you've been around somebody who travels.
Yeah, and then again, too, I think it speaks to the fact that while most people can handle some of these illnesses, there are those in the community who cannot, and that will be very detrimental too. And the point is making sure that we're protecting them, right?
Absolutely. Yeah, this is the time of year as we're getting organized and starting to think about things. Let's think about our health and kind of get ready for fall. Think about the seniors, think about the folks that can't get vaccinated.
Okay, and then when it comes to vaccinating your own children, how do you know what vaccines your kids need?
Right.
Yeah.
Yeah, it's a challenge for all of us. So
Yes.
I'm a big fan of Docket, our new health app. It is super slick. You can download it from any app store. And you can get right access to the registry and your immunization information. This has only been out for a couple of years now. With the COVID and stuff going on, it was soft. You know, it's hard to get the word out initially because we were so focused on COVID. But this app is super great. It's on my phone. If somebody needs my immunization records, my child's records, I can pull it up right there on my phone.
That's fantastic.
Yeah, you can still go to the health department or your doctor and get the records from them, but boy, the app is super easy and very secure.
Yeah, I love that because so often, right, you go to the doctor and they give you the paper form to
Yep.
take with you or keep in your wallet, but I always forget it. And there's an app for that.
Yes, there's an
Which is
app for it
brilliant.
now.
Yeah.
We and some other state health departments have something similar, but this is secure. It's Idaho information,
Okay.
and it's so handy.
And again, the name of it?
Docket.
Doc It. Okay, great.
Yeah, Docket, like all one word, DOCKET.
Okay, okay, with an ET. Got it.
Yeah.
And where do people go to learn more, especially if they have questions about immunization, what it might look like, potential reactions?
Yep.
Where do they go to learn more?
Yeah, they can go to immunizeidaho.com. They can go to the Health and Welfare website. They can go to CDC's website. So there's lots of places to go and find really good immunization information.
And Dr. Hunt, I do want to ask you really quick before we wrap this up, who are individuals in our community who should not get vaccinated?
Yeah, so certainly if you have questions about your own health, your immune system is compromised, you're undergoing chemotherapy, something like that, work with your doctor or any other trusted healthcare provider. Maybe it's your pharmacist. They can check your record. You can tell them about any questions you have and make sure that you're the right, that shot is safe and right for you.
Wonderful. Great to have that reassurance, right?
Mm-hmm, for sure.
All right. Thank you so much, Dr. Hunt. Greatly appreciate it.
Yeah. Thank you.
And everyone, stick around because coming up, we have a lot more to come right here on Idaho Today right after the break.